Makoplasty partial knee resurfacing is an innovative procedure designed to provide quicker recovery and improve surgical outcomes for patients with joint degeneration in one or multiple parts of the knee.
I'm very active, and I was always doing a lot of walking and charity walks and playing a lot of golf. And it was starting to get less and less, where I couldn't do my 3-mile walks or my 5-mile walks anymore. I was getting down to a half a mile. Was getting very, very painful. And golf was a real chore because it was real hard to swing a club with a lot of pain in one part of your body.
I tried the arthritis drugs, I tried swimming, I tried the series of shots, and everybody kind of looked at me and said, "Jean, when the time comes, you're going to know," and I did.
When I walk anywhere, I usually have to use a cane, or I kind of hobble. I take a cane just for insurance in case my knee gives out on me. I have arthritis in my both knees. I decided, well, I got to get something done with this, because a friend of mine told me if you live another 10 years, you don't want to be like you are now, so you better get something done.
There are certain things that can cause a knee to begin to break down. Certainly, the common sports injuries, loss of a major critical ligament, can cause the knee to be unstable and therefore move in abnormal directions. And instead of the nice, smooth, more or less hinge-like movement of the knee, you'll end up with something that's not stable and begins to move erratically, and people can't even trust their knee.
I couldn't stoop down, I couldn't squat, I couldn't stand for a long time. When I would sit in the movie theater, which I like to go to, I'd have to sit at the end so I could stretch my knee out.
I kept thinking I would probably need a full knee replacement, but I came into his office. He took very extensive x-rays, which hadn't happened to me before, and told me that most of my knee was healthy and that I was eligible for a partial knee replacement, which made me extremely happy.
Well, I believe that partial knee replacement does dramatically change patients' lives. It allows them to get back to the activities that they had been doing when they were younger, before they developed arthritis.
When we talk about knee replacement or partial knee replacement, some people think that we cut out the knee and we put a whole new knee in, but actually both the knee replacement and the partial knee replacement are just new surfaces are being put on the bone. And there's 3 different joints or surfaces in the knee. There's the medial or inner side, the lateral, the outer side, or the patellofemoral, which is just underneath the kneecap. So all of those could be individually replaced, or they could be replaced at one time.
The Makoplasty procedure is both an excellent procedure for older patients, for allowing a quicker recovery and removal of the pain, as well as for younger patients who can resume high level of activities with a more natural feeling knee, because it's only a partial rather than a full knee replacement.
He basically told me that he was only going to remove the damaged part of the knee, that the inner part of my knee and the kneecap were fine, so he would just work with the lateral side, which is where the damage was.
He told me, he said that if it works real well, it'll last as long as a full knee replacement, and you'll keep most of your knee. And so that sounded really, good to me.
Partial knee resurfacing may be a good treatment option for patients with early or mid-stage osteoarthritis of the knee that has failed to respond to non-surgical treatments or non-steroidal anti-inflammatory medication. Typical Makoplasty patients have knee pain that occurs with activity, usually on the inner knee or under the kneecap. Symptoms also include start-up knee pain or stiffness when activities are initiated from a sitting position.
With the Mako technique, what happens is this. A CAT scan is obtained of the patient's knee, then literally that CAT scan is incorporated into the Mako device, into the unit. That unit now has a virtual image of what your knee looks like, from every bone spur, every joint space loss, it's in there. Then we can look at that study and say exactly how we want to replace either the inside of the knee, the outside of the knee, or both, and even behind the kneecap. And we can do it with such precision, it's down to less than 1 degree, less than 1 millimeter of accuracy. It's reproducible, and it's phenomenal.
When you do a knee with just mechanical alignment, you're going by feel, you're going by the alignment of mechanical devices, rods, and instruments that attach to the bone in a mechanical way. When you do it with the Makoplasty, you're doing it with the computer, and you're not going to vary from that by even a millimeter.
So one of the first things that we do while setting up this procedure is go to the CT scan views of the patient to get our approximate sizing and alignment of our implants.
First thing we have to do is tell the computer where your knee is in that room. It doesn't know. We have ways of putting tiny markers just through the skin to help the infrared cameras pick up the location of the knee. Following that, we begin the surgical approach. This can be made through an incision about 3 to 4 inches versus the typical 5 to 6, 7 inch total knee incision. Then we begin to use a small burr, and we move just precise amounts of bone to put the implants in just the correct position.
By selectively targeting the portion of the knee that has been damaged by osteoarthritis, surgeons can resurface the affected area without compromising the healthy bone tissue surrounding it. Robotic arm technology helps surgeons isolate and resurface only the arthritic part of a knee without replacing the entire knee.
I've already talked to several people who found out I was having a partial, and all of them have called to find out how I'm doing, and I've suggested before they make a decision, go in and talk about getting a partial.
Where would I be now? Probably just sitting in a chair at home. I wouldn't be doing very much, I'll tell you that. And I'm thrilled with it, I'm telling you, I'm thrilled. I would recommend anyone that needs any problem at all, have that done.
Well, it was a shorter recovery period, and as an example, I wanted to walk out of the hospital the day after the surgery. They wouldn't let me, but I was walking, and I didn't use my walker because it was too awkward. And about a week and a half later, I was walking back 1.5 miles, and then after 2 weeks, I was back to my 3 miles.
Coming up, Eisenhower Medical Center is the only facility in the Coachella Valley offering state-of-the-art Da Vinci technology for treatment of prostate cancer and hysterectomy. This innovative, minimally invasive approach results in a faster recovery and a quicker return to normal activities.